Research is how healthcare professionals find out the best way to treat illnesses or health conditions. Most hospitals and many healthcare professionals are involved with research. It's an everyday part of what we do. GPs, doctors, nurses, physiotherapists, pharmacists. Everyone wants to make the care better for people who need it. All research is looked at by an independent research ethics committee who check that it is okay for people to take part in. Taking part in research may or may not help the person taking part, but it will help healthcare professionals learn more about the best treatments of people who have the same illness or condition. We will only ask you if you would like to take part in research if your doctor says it is okay for you to take part. A research nurse will talk to you about the research and you can ask questions about it. If you say yes or no, it will not make a difference to the care you receive. You will still be looked after by your healthcare team. If you say yes, you will be asked to sign a form called a consent form to show that you want to take part in this research. Even after you've signed the consent form, you can still change your mind and say you no longer want to be part of this research. Sometimes people are too ill or not able to understand the research to say yes or no. Then someone close to them, a family member or friend, will be asked if they think that the person would like to take part in research. If there is no friend or family member able to talk to the research nurse, then an independent doctor who is not part of the research study is asked to say yes or no. As soon as the patient is well enough and is able to understand the research later on, they'll be asked if they want to stay in the research study, and they can say yes or no. This video is about a research trial called REMAP CAP. This research trial is happening in 150 hospitals in the UK and in more than 300 hospitals around the world. It is looking at which medicines will most help people when they're in a hospital for pneumonia, flu, or COVID-19. Research has already given us some information about what might help treat people who are in hospitals with lung infections, flu, or COVID-19. But we need to know more, especially as new medicines have become available. This research is called a platform trial. This means that several different medicines can be tested at the same time, and we can find out which ones work best and stop using the ones that aren't helping people with lung infections. New treatments can also be added. If you join this research, a computer will select one or more treatments for you. This is called randomization and means people are put in a group by chance, which allows us to compare different treatment groups. Are you ready to make treatment better for people with lung infections? Speak to a research nurse to find out more. If you agree to being part of this research, you'll be asked to sign a consent form and given a copy of it along with a privacy notice.